Hey everyone, it's Dr. Miller from Liberty Pet Hospital in Powell, Ohio. Today's topic is going to be allergies. I know a lot of your dogs and cats suffer with itchy skin, ear infections, paw infections, stuff like that. I'm going to try and keep this short and sweet to give you some information, but we'll probably have to talk a lot about it more in depth in the exam room. First, when your pet comes in itching, scratching, licking, we want to make sure there's not an infection or there aren't any parasites on the skin. Easy fixes are fleas, mites, also known as mange. We want to make sure there's not something like that we can cure. Next, if there's infection on the skin, usually that's secondary to the primary problem. So your pet is scratching, itching, licking, rubbing their face or ears, and as a result, the skin barrier is roughed up, and then bacteria or yeast will colonize the skin. So the symptom of itchiness creates secondary infections, and we've got to make sure there's not an infection, and if so, treat it, and then also help with the itch. A lot of clients get frustrated that they keep bringing their pet in for allergies, itchy skin, recurrent ear infections, anal gland problems, stuff like that. And please keep in mind, we can always treat the symptom, but if the symptoms keep coming back, then there's likely an underlying cause, and the best thing to do is try and identify that underlying cause in hopes that we can lessen the recurrence of the symptoms or lessen the severity and frequency of the symptoms. So let's start with young dogs. If we have a dog under the age of 2, with a non-seasonal itch, meaning irregardless of the season, they are having some type of allergy sign. They're more likely to have a food allergy than an environmental allergy because they haven't lived through enough seasons, enough springs or falls that we see in 3, 4, 5, and up to truly have seasonal allergies. There are exceptions to that, but generally speaking, younger dogs are going to be more prone to a food allergy, and there is nothing wrong with the food you're feeding. I have owners coming in who have tried many different diets over the counter. They feel bad if their pet's still having signs, and please don't feel guilty. There's nothing wrong with the quality of the food you're feeding most often. It's the dog's been repeatedly exposed to the same ingredients, and usually if they're allergic to a protein, it's the meat or vegetable protein, not the grain. I know that television and people at the pet stores are educating you about grain-free diets and grains being a high allergen, but that's typically not the case. If you're looking at the top 3 things dogs are allergic to, it's beef, chicken, or dairy. So grains are way, way down the list, and most of us veterinarians are not concerned about grain allergies. We're really looking at the history of what your pet's eaten protein and vegetable-wise before we're even thinking about grains. So I know you're trying, and I appreciate all of you trying different diets over the counter in hopes it's helping your pet. But if you feel that frustration, please call for professional help, and we can dig deeper. So when it comes to foods, you're going to see foods over the counter that look like prescription foods, but they're not, and it all comes down to the manufacturing process and the way that they're created or made. 87% of over-the-counter foods that were limited ingredient tested positive for some other protein, whether it was a meat or a vegetable that was not on the label. And also ingredients in over-the-counter foods can be swapped out by the manufacturer without them pulling the food, because the food over the counter is not a therapeutic diet. That is different than prescription limited ingredient diets. If there is a shortage of rabbit or kangaroo or salmon or something that goes into the food, they don't sell the food or substitute something else out. We know there's a shortage, and we transition pets to another diet temporarily that we hope will not cause any flare-ups, and then get them back on the prescription food when it's ready. Also, think of a child with a peanut allergy. If you had a child with a peanut allergy, think how careful you are about everything you feed them, how the food's handled. It's the same idea. I wouldn't take a child with a peanut allergy to Dairy Queen and buy them a Blizzard. Even if their Blizzard didn't have peanuts in it, somewhere that day the machine has touched peanuts, and it's the same idea with over-the-counter foods. They'll make chicken and rice, beef and rice, rabbit and potato, kangaroo and oat, and different ingredients are touching those machines without sterilization between. With prescription foods, the manufacturing process is very pure, so it is a little bit more of an investment for those prescription foods, but it's because of the labor and the handling of the ingredients that make it so pure, and it's truly meant to be a therapeutic trial. We aren't just saying that. I know owners think that, we really need the prescription food. Yes, you do, and we usually feed that for 8 to 12 weeks. No table food, no treats, no biscuits, rawhides, antlers, any other thing but the food or prescription treats. And then after that, we can talk about introducing fruits and vegetables, but that's a discussion for the exam room. So if you have a young dog with recurrent itchy skin that is non-seasonal, we're going to talk about a food allergy. If you have an older dog with non-seasonal, 4, 5, 6 and above, non-seasonal itch or scratch or ear infections, we're also going to talk about a food allergy, but they could have environmental allergies too. Dust mites and storage mites, they can be exposed to year-round, unlike things that are outside, like pollens from grasses and trees and weeds. They can be exposed to molds. They can be exposed to flea saliva, cockroach saliva, down feathers, human dander. There's a whole list of things that they can be exposed to, even if your dog or cat lives primarily indoors. When our dog was 4 years of age, our Great Dane, she started getting infections on her paws, and we'd fix the infection and fix the itch, and it would come back. After the third round, we said, that's it, we've got to figure out the underlying cause, because she was suffering and I didn't want to keep her on antibiotics long term, and obviously it wasn't a one-time flare-up, it was repeatable. We did a food trial with her. It did not improve her signs. Then we allergy tested her with a dermatologist, and she was allergic to everything. Pollen from grasses, trees, weeds, molds, human dander, dog dander, cat dander, flea saliva, dust mites, storage mites. So she's on allergy injections, and you can do drops under the tongue twice a day for life, or injections that can be tapered out to about every 2 weeks, in hopes that you are desensitizing the immune system to the things they're allergic to in the environment, indoor or outdoor, in hopes that we'll have fewer flare-ups, and if they are flare-ups, hopefully less severe. But please keep in mind, allergies are often chronic. You're lucky if you have a dog that is just itchy for 2 weeks in October and never again. We always have to watch and make sure the immune system doesn't change and it doesn't progress from October, November, December, and so on. But please keep in mind, we can treat symptoms, but the best thing, if it's recurrent and chronic, is to be looking for the underlying cause. Not every pet can we get to 100% improvement, but we hope that we can improve them 80% of the time, and lessen the need for medications. When it comes to medications, we can use simple things like omega-3s, medicated shampoos to help improve the skin barrier, antihistamines. Those are pretty mild, don't work great, but they can help some animals with mild symptoms. If it's moderate to severe, then that's where we're looking at steroids, some combination of steroid or antihistamine, an injection called Cytopoint, a medication called Apoquil. There are a lot of different things we can then do as like a next level treatment if we still aren't ready or able to look for the underlying cause. So I hope some of this information is useful. I'm trying to think if there's anything else I want to tell you. One thing I want to say about prescription diets, there are 2 ways we can feed prescription foods. We can either pick a protein and vegetable your dog has never had before, or if you're like some pet owners who've tried everything over the counter, we may run out of limited ingredient, meaning first a protein and vegetable they haven't eaten before. We may have to go with a hydrolyzed protein diet. Hydrolyzed protein means the protein chain of the protein is broken down into small pieces by the pet food company. The kibble is still a normal size, but the hope is that the immune system will not be triggered by the smaller protein size chain, and then your pet will respond. Our Great Dane had last spring recurrent anal gland problems, itching, licking, redness, bloody anal glands, impaction, a lot of discomfort, and anal glands are usually a food allergy until proven otherwise. She's already environmentally allergic. She's already on allergy injections. We put her on a hydrolyzed protein diet because she's had various novel proteins as we worked through her allergies, and it fixed it. Great success story. She has no anal gland impaction, redness, itchiness, no blood. Her anal glands are perfectly normal, so she will stay on that diet lifelong. We also don't think we have a way of animals outgrowing environmental allergens or food allergies. We think it's there for life. So if your pet does test positive to environmental allergens, they'll often be on allergy injections or drops for life. Also, I want to mention there are 2 ways to allergy test dogs and cats. We can do a blood test here in the hospital. It gets it right about 85% of the time, but we have to do the test when your pet is actively having symptoms because we're looking for complexes in the blood to see what the pet is allergic to. On the flip side, we can get you to a dermatologist in the area to do a skin test. Your pet would be sedated, the fur would be shaved, and a little grid would be made on the skin, and then the allergens would be injected into the skin surface to see what they react to within 10 to 15 minutes. The nice thing about the skin test is it can be done any time of the year because the allergens are being injected into the skin. That is the gold standard. We think it's the best test. Sometimes dermatologists will use a combination of both. They'll run the skin and the blood, or kind of look at both of them combined to see what the results come back as. Please keep in mind there are no blood tests that are reliable and repeatable for food allergies. I know a lot of you will read about them online. There are independent labs that you can swab your dog's cheek or get a little bit of saliva or hair and send it in. If you speak with a dermatologist at Ohio State, they would say, please feed the food for 8 to 12 weeks and do not waste your money on tests. Not to say that dermatologists at some point may run a food test, but generally speaking, it's not something that truly diagnoses diagnoses the allergy. We're trying to pick a prescription food with a protein or vegetable or a hydrolyzed protein that hopefully your pet will respond to. So one of the big picture things I just want to repeat again, we've got to make sure there aren't parasites. If your pet has allergy symptoms, please keep them on flea and tick prevention year-round. Sometimes there can be a threshold to allergies where maybe they're exposed to something that's causing a little bit of itch, then they get bitten by a flea and that makes it flare up even worse or get flea infestation. So keeping them on flea prevention year-round in hopes to keeping them below threshold along with everything else they're dealing with is ideal. Allergies generally are not cured but maintained, and hopefully if we find the underlying cause, we can lessen the symptoms and lessen the drugs used. If we are treating symptoms, be prepared that we might get to see you a lot. We might have coffee talk every couple weeks or every spring or every season if signs come and go. There are some medications pets can be kept on long term, but again, I'm a true believer if we can find the underlying cause, and immunotherapy or allergy injections and food are really the only two preventative measures we have. Everything else is a treatment, whether it's Apoquel or steroids or antihistamines. We're really treating symptoms really than helping the underlying cause. If your dog has a seasonal allergy like our dog Secret, meaning environmentally they need help, studies have shown that they have a poor skin barrier. Not food allergic dogs, but environmentally allergic dogs. They have a poor skin barrier. So if you think of a brick wall where there's brick and mortar, the brick would be the pet's cells on the skin, and the mortar, the interstitium between those cells. The mortar is what is poor in a lot of these dogs, and so pollen and different allergens get stuck between the skin cells, bring inflammatory cells from the immune system to the skin layer, and then that's what causes red paws or red ears, and then they scratch and itch and create infections. So that's often the case with environmental dogs and why they need a better hygiene plan. You might have heard me talk about that in the bathing video. Secret is on a prescription medicated shampoo. We have 2 of them. One that we use when she's really oily and greasy, and one that we use as a maintenance to help with improve her skin barrier. So we can always help you with that. If you come and bring your pet in for an exam, we can talk about helping improving the barrier, what we want to do, how long we want to, how often we want to give it or do it for. Also talk about treatment versus finding the underlying cause, and partner with you to make the best choice for your pet. I don't want to recommend bathing your dog twice a week during flares if you absolutely can't do it, or pilling your cat if you absolutely can't do it, but just know that we're here to help you and we're going to do the best we can. So I hope this talk wasn't too long. I hope you found it interesting. If you have any topics you want to hear me discuss, please email me at info@libertypethospital.com. And if you liked the video, please like it and share it with your friends so we can help spread the word. I hope you guys have a great day, and I will talk to you soon.